In this video, I want to talk about if you have knee pain, what you should do. I've seen this work with teenagers, I've seen this work with adults, I've seen this work with people pushing 70 years old, so I just wanted to share it with you and hopefully it helps you. So first of all, if you have knee pain, now of course I don't know the severity of what you have, but first and foremost you need to focus on movement changes. For example, you may be a runner. Somebody who runs a lot. Obviously, you've put a lot of stress on that joint over the years, but also there's this idea out there that when we exercise, our knees should never go over our toes. There's also ideas out there that if you have knee pain, it's most likely plays a role as well with what's below your knee and what's above your knee. And I got this idea from a guy, he goes by Knees Over Toes. I will put a link in the description. Highly recommend his program. It's not expensive. He's got some free stuff as well, but I've seen it help my son who was playing basketball. It helped me, my wife, and other people I know who've benefited a great deal. It's a very different way to think about movement and how to ease some of that knee pain. Speaking of knee pain, if we want to move on to the thing that I found to be the most effective, safe, natural way to treat knee pain and other types of pain for that matter would be PEMF. That's pulse electromagnetic field therapy. I've talked a lot about that before on the channel in other videos. Very beneficial at treating knee pain. Again, you can also treat it below and above the knee because PEMF gives you that ability to direct the fields, the PEMF fields at different parts of the body. So you're not only going to benefit knee-wise from PEMF therapy, but other spots as well in your body. So I would encourage you to look at that. And some of these things, if you want more information, make sure to go and grab my free checklist. I talk about this much more, including the machines that I personally use for PEMF. Now let's talk about, when it comes to knee pain, maybe you have arthritis, maybe you have even bone on bone. Is there anything out there that can regenerate tissue? Now, there are some things that are promising like PRP and that can be helpful. Some of the peptides can be helpful, but what I found to be the most effective is stem cell therapy, and in particular, umbilical cord stem cell therapy. There is a particular company I use and recommend. Again, go grab my free checklist. I talk about that there. Just want to share a few pictures. These are x-rays from people who have done it. You can see in this first one on the left. Now, I want to point out these are x-rays, so you can have some movement when the person goes down to get their second x-ray, but these were also accompanied by less pain, improved mobility in these people as well. So I do want to point out x-rays aren't perfect, but this gives you a very good idea of what is possible. This was a person with a moderate arthritis with meniscus tears in their knee. You can see this space was 4.3 millimeters, roughly 3 months after their stem cell therapy. They're getting more of this space here. There is beginning to see some regeneration. Another one you can see, obviously they had surgical repair there, but on the right side here, 6.72, then we go to 8.82. Over here on the left side was a much bigger improvement from 3.6 to 10 I believe that's 5.7 millimeters. But again, we're seeing some of this regeneration. And finally, this last one is true bone-on-bone arthritis. So you can see it, and now we're beginning to get some of this cushioning and regeneration. So stem cells had a number of people who did it. It did benefit them. You just have to go to the right place. Okay. Finally, nutrition. This is often overlooked. A lot of people with arthritis, knee, whatever the joint may be, nutrition plays a big part in that. Kind of keeping it very simple here from a nutrition perspective, you do not want to be giving your body anything that would promote inflammation. So we want to eliminate grains, processed foods. Anything with seed oils is going to be very beneficial if you can pull those things out of your diet. Focus on all three macros. Yes, carbs, fat, and protein. Get a balance of those and get them from a natural source. Stay away from processed stuff. That can get a lot of mileage. But these four things, you guys, for folks I've known who've had knee pain, and myself included, these four things have helped tremendously in that regard. They're natural, safe, and they work. So Let me know in the comments other topics that you'd like me to cover, what might be helpful for me to cover. And speaking of helpful, hope the video was. I will see you in the next one. Thank you.